Okay, knock knock. Hi, my name's Els. I'm going to be a student nurse today. I'm going to be performing an attitude assessment on you. Can you tell me your full name and date of birth?
Caitlin Croft, 9/28/06.
Okay. Can you tell me why you're here
I'm here to have a head-to-toe assessment.
and where you are?
I'm at the dorms.
Okay. Can you tell me the month and the year?
Yes, November 2025.
Okay. So I'm going to first start by performing hand hygiene and donning on some gloves. We're going to start with putting your hands out on your thighs, and then you're going to flip it upside down and keep flipping it as fast as you can. Okay, perfect. You put out your palms of your hands and close your eyes. I'm going to draw something on your hands, in your palms, and you're going to tell me what it is.
9.
Yeah.
2.
Mm-hmm. Yeah, keep them closed, your eyes closed, and your hands out. I'm going to place something in each hand, and you're going to tell me what it is. A familiar object in your hand.
10.
Yeah.
Claw clip.
Okay, thank you. You can open your eyes. Can you squeeze my fingers and put your hands out like this, and then keep your angle. So I'm gonna push against you and test your strength against resistance, and then you're gonna push against me too, and then pull and you pull, and then you're gonna push and then pull. Okay, thank you. Can you stand up for me or test your balance? You put your heel to toe, and then walk in a straight line. Thank you. Thanks. Okay, so we're gonna check. We're gonna check your hair. Look for any divots, any nits, any bugs. Check your hair consistency. Can I touch your hair? Okay. Oops, sorry. Check if there's any bumps. Check if it's round and symmetric. Okay, now we're gonna check we're gonna palpate her sinuses. Let me know if there's any pain or tenderness.
No.
Okay. Now I'm going to pull down. Check her square if it's white. And the top if it's white. And then I'm gonna push down her tragus. Sorry, not her tragus. On her mandibular. Just open your mouth and close it. Or her TMJ. Wait. We're checking her TMJ. Okay, open. Checking for any clicking or popping, and then move your jaw side to side. Okay, none of that. Okay, now we're gonna check for symmetry on her face. Check her eyebrows, her eyelashes, the color, her labial folds if it's symmetric. So now we're gonna check her eyes. So we're gonna assess for perla, which is pupils equal, round, react to light, and accommodation. So you look straight ahead. I'm just gonna shine a light in your eyes briefly. Just looking for that pupil constriction. Okay. And then you're gonna look at the light here. We're gonna look for the corneal reflex to see if the light appears in the same spot in both of her eyes, pupils. And it is. Okay, so you're gonna follow the pen light with your eyes and keep your head still. Checking for smoothness of the eyes. Following. Okay. So now we're gonna test your peripheral vision. So look at the finger. Oh wait, never mind. Okay, wait. Yeah. So tell me how many fingers I'm holding up.
2. 3. 4. 1.
Okay. Perfect. So now I'm gonna palpate her tragus and her artery meatus to see if there's any pain or tenderness.
No.
I'm gonna pull it out and back. Check inside her ears for if it's clear. And same for the other side. Do you feel any pain or tenderness?
No.
And then, so can you close your left ear? I'm gonna whisper something. You're gonna tell me what it is.
Book.
Yeah. And then your other ear.
Journal.
Okay. So now I'm going to check your nose. So I'm just gonna look inside, checking for any nasal drainage, color of mucosa. So can you close one side of your nose and breathe in and out? We're trying to, and the other side, we're seeing if it's clear and smooth airflow. Now we're gonna check her mouth. You say off. Open your mouth, I mean. We're checking if she has all her teeth, any cavities, checking her gums, the color. You lift up your tongue, put it to your mouth, checking the frenulum to see if it's centered. And then can you stick out your tongue, say checking if that uvula rises. And while we're doing this, I'm assessing, we're assessing for, I think I said it, but we're assessing for symmetry and muscle tone and any involuntary movements. Now we're going to assess her JVD. So can you look that way? I'm just looking to see if there's any like bulging vein. Look that way, 30 to 45 degree. No, okay. So now I'm going to assess the cardiovascular. Wait, just kidding. I'm gonna check her if she has any edema, any swelling, her temperature, in her arms and legs, in her extremities, checking her skin turgor, and checking her capillary refill, and seeing if her skin's moist and her capillary refill is less than 3 seconds, which is normal. Checking if her skin color is appropriate for her ethnicity. I said the moisture, skin texture, turgor, capillary refill. Yeah. Now we're gonna do your cardiovascular assessment. So we're gonna first check her carotid. I'm gonna palpate her carotid one at a time, and then with the bell of my stethoscope, I'm going to hold it here. Do you hold your breath? Okay. You breathe and hold your breath. Okay. Now I'm gonna assess. I'm gonna be looking at the shape and contour of her chest, noting if the ratio from anterior to posterior and side to side is 1 to 2. And then we're gonna listen for 30 seconds with the diaphragm and the bell, starting with the aorta. 30 seconds, and then pulmonic, and then the tricuspid. Erb's point, and then the tricuspid, and then the mitral, and then the bell. 30 seconds, 30 seconds, 30 seconds, 30 seconds, and 30 seconds. And I'm going to check if the PMI is palpable. It should be palpable, but you should not be able to see it. Okay, now I'm going to check her pulses. Okay, check on both sides. So I check her radial pulse, and it should be the same. And then her brachial pulse on one side. And then we're going to check her dorsalis pedis. And then the posterior tibial pulses, and each are +2, which are normal. Now we're going to check lung sounds. Respiratory. Okay. Okay, so there's 6 points. Okay, so you breathe in and out. Just making sure we get those clear sounds, no adventitious sounds. Okay. Now we're gonna check the back, the posterior side. Okay, so you go pull out your arms. Let's just see if there's. Okay, we're gonna be checking 8 areas. So breathe in and out. Okay. So checking her spine to see if there's any lumps or anything like that. And then so I'm put my hands like this and just check for the expansion. So you breathe in and out if it's symmetric. Okay. And we check for tactile phrenitis. So say 99.
99.
Okay. We're just looking for that vibration. Now we're gonna check your abdomen. So can you lay down for me? Okay, can you lift up your shirt? So we're gonna inspect her abdomen, checking for if her it is concave, flat, she has, yeah. So yeah, we're gonna auscultate each quadrant, starting with the right lower quadrant, then the right upper quadrant, then the left upper quadrant, then the left lower quadrant, going in a clockwise thing. We're gonna listen for bowel sounds for at least 1 minute in each quadrant, and we're checking to see if it like bowel sounds are normal. So 1 minute or 30 seconds at least, but if you don't hear anything, you have to listen at least 5 minutes to call it absent. Okay. Left upper, left lower, and then gonna listen at her aortic, and then her renal and iliac, and then her femoral, and then now I'm going to palpate. I like palpate to look for any masses. I'm gonna press down a second. Now we're gonna do a deep palpation. Looking for those masses or anything like that, but nope. It's clear. Okay. You can you can sit up, and that concludes my HEPSO assessment. Thank you.